This is why Lyme disease is so extremely difficult to kill off. The third and last scholarly report that I want to read to you guys is also very important, kind of just touched on what I was saying. Quote, most research into bacterial pathogenesis has focused on acute infections, but these diseases have now been supplemented by a new category of chronic infections caused by bacteria growing in slime-enclosed aggregates known as biofilms. My speech right now is really bad. Biofilm infections such as pneumonia in cystic fibrosis patients, chronic wounds, chronic itosis media, and implant and catheter association infections affect millions of people in the developed world each year, and many deaths occur as a consequence. In general, bacteria have two life forms during growth and proliferation. In one form, the bacteria exists as a single independent cell, planktonic, whereas in the other form, bacteria are organized in sessile aggregates. The latter is commonly referred to as a biofilm growth phenotype. Acute infections are assumed to involve planktonic bacteria, which are generally treatable with antibiotics, although successful treatment depends on accurate and fast diagnosis. However, in cases where the bacteria succeed in forming a biofilm within the human host, the infection often turns into an untreatable and will develop into a chronic state. The important hallmarks of chronic biofilm-based infections are extreme resistance to antibiotics and many other conventional antimicrobial agents, and an extreme capacity for evading the host's defenses. Basically, that's the scholarly terms for what I had just described to you before this, about all of the bacteria, gunking up together and creating their own slimy biofilm to have a happy little life in your body somewhere and hide away, and your body's defenses just don't recognize them because they are covered and coated. And so they're very smart. Lyme bacteria specifically is extremely intelligent. It not only will hide in biofilm, but it also, a whole another subject, it gets into a cyst form and can become dormant in that form, which is why you maybe won't recognize it for years. So you can have a cyst in a biofilm, which you have to treat each thing separately. You have to kill the biofilm, you have to kill the cyst, and then you can treat the bacteria. So this is why Lyme disease is so extremely difficult to kill off, and usually, most likely in most cases, comes with at least one co-infection, if not dozens. Mine being marcons and parasites and mold and fungus, candida being one of them, the black mold being another one. And then there's the typical ones that come along with being transmitted by a tick as well. I mean, I think the last study that I saw, I don't even remember the amount. It was a ridiculous amount of infections that they found just in the last 5 years. I don't want to give a number because I don't remember. In the last 5 years that they have just discovered that it's an insane amount. That it's like, okay, so I've been trying to figure out what this is for the last 10 years, and now they're coming up with stuff just in the last 5 years that they are just discovering, which means that they don't even have treatments for it yet. So how many people are having these diseases that they don't even have treatment for? They don't even know specifically how to test for it yet. Some of them, they've only had one person test positive for it. It's a brand new disease. So how many other people have they just not even in a lab been able to detect this yet, So that just goes off into a whole nother subject, but I hope that I cleared up what biofilm is. Hopefully my biofilm is getting cleared up, and I am definitely seeing it coming out in all different forms, lovely as it is. Please ask questions, and I will hopefully be able to answer them the best that I can, and I will try my best. Good luck with all of you that are going through this. I feel your pain, literally, in my own way anyway. We're all very different, but everybody with Lyme disease is dealing with this very differently. They all have different co-infections. Just FYI, for those of you who do have family members and friends with it, and you yourself don't have it, everybody is very different. Every individual is extremely different. I love you guys, and I hope you guys have a great day.